Okay, let us continue with our lecture on your Neisseria gonorrheae. Okay, let us discuss first the general characteristics of your Neisseria gonorrheae, also known as your gonococci. Okay, so as we mentioned previously on our previous discussion, they are never considered as normal flora, di ba? They are never considered as normal flora, and then man is the only known host for Neisseria gonorrheae. Okay? And then as for the mode of transmission, it can be transmitted obviously by sexual contact, or it can be transmitted to newborn by during giving birth, okay, kapag infected yung mother. Okay? Actually, it is the leading cause of sexually transmitted disease. Okay? And then it is usually localized to mucosal surfaces in the area of initial exposure to the organism, such as the endocervix of the females, urethra of the males, conjunctiva of the newborn, even the pharyngeal area and the rectal area. Yan yung mga usually affected area once na ma-acquire mo ang gonorrhea. Okay? And then, kung mapapansin nyo class, bakit kaya ito yung parang pinaka-target ng bacteria natin, itong area na to? Or what is the reason why they are able to survive in this mucosal area? Okay? Due to the presence of what? Due to the presence of their IgA protease, diba? Together with your Neisseria meningitidis, they have this virulent enzyme, okay? Which is essential for their survival, of course. Okay? And then, for the characteristic of your Neisseria gonorrheae, okay, they usually produce smaller colonies, okay, compared to your other Neisseria species. And then, as for the carbohydrate fermentation, they are able to, they are capable of fermenting your glucose, okay, specifically glucose, mga glucose fermenters yung mga yan. Okay? And then we also have this other strains of gonococci that requires your arginine, okay, arginine, uracil, and hypoxanthine. Okay? However, hindi naman lahat ng gonococci they require this, but some strains of gonococci they require this arginine, uracil, and hypoxanthine. And then these rare isolates, they tend to grow most slowly on primary culture. And then also they are susceptible to vancomycin. Okay? Apart from this one, they are also said to be more fastidious compared to other gonococci strain. Okay, and then as for the antigenic structure of your Neisseria gonorrheae, okay, the principal virulence factor of your Neisseria gonorrheae is the pili of the bacteria. Again, you recall, what is the function of this structure, your pili, di ba? They enhance attachment to the host cell, okay, inhibiting now phagocytosis. Yun ang parang pinaka primary function of the pili. Okay, they enhance attachment to the host cell. Okay, and then they also inhibit phagocytosis. Okay, aside from pili, this Neisseria gonorrheae, they have this what we call pore proteins. Yung pore proteins na yan, class, they may impact intracellular killing of the gonococci within the neutrophils by preventing the phagosome-lysosome fusion process of phagocytosis. Kumbaga, ito yung pinaka ini-inhibit nila na part ng process ng phagocytosis, your pore proteins. Okay? And then we also have this what we call OPA proteins. These proteins, they function naman in adhesion of gonococci within the colonies. Okay? So they function in adhesion of gonococci within the colonies, and they are also able to or rather they serve as an attachment to host cell receptors, specifically your CD66. Now, let us go over with the clinical infections caused by your Neisseria gonorrheae. Okay? Now, these bacteria kasi class, they usually attack the mucous membranes, okay? Specifically the genitourinary tract, the rectal area, even the eyes of the newborn, okay? And then even the throat, okay? Yung oropharynx ng host, okay? Okay, and then once na ma-infect ang host, these bacteria, they usually produce suppuration that may lead to tissue invasion. Okay, that is why they are also capable of causing bacteremia and even endocarditis. Okay, so they are capable of tissue invasion also. Okay, and then if this infection, if left untreated, it usually proceeds to chronic inflammation and fibrosis. Okay, so number one, most common infection caused by your Neisseria gonorrheae, of course, we have your gonorrhea. Gonorrhea meaning flow of seed, okay, or brothel, okay, is an acute pyogenic infection of columnar and transitional epithelium. Okay, by the way, brothel class meaning house of prostitution. Okay, so brothel meaning house of prostitution. Okay, kasi nga sexually transmitted yung disease na yan. Okay, tapos if I am not mistaken, gonorrhea is considered as one of the oldest diseases that exist. Okay, your gonorrhea. Now, your gonorrhea, it has a short incubation period, usually 2 to 7 days lang yan. Okay? Usually after an incubation period of 2 to 7 days, signs and symptoms may manifest by the patient. Okay? Symptoms include purulent discharge, especially among the males. Okay? Lower abdominal pain also is very common. Dysuria. Okay? Dysuria may also be seen. What do you mean by when we say dysuria? Dysuria, ibig sabihin, painful urination. Okay? Dysuria and even vaginal bleeding among the females. Okay? Then aside from gonorrhea, urethritis, okay, or purulent urethritis, okay, also caused by this bacteria. Usually, mas common ito among the males. Okay? Now, if males have this kind of infection, they usually manifest a discharge with yellow creamy. We describe it as yellow creamy pus discharge, and dysuria is also common for this urethritis. Now, this urethritis, they may extend to the epididymis, okay, and then as suppuration subsides and if left untreated, fibrosis may occur, especially dun sa area no epididymis. Kaya nga it can lead also to infertility or sterility among the male. Pwede nilang ikabaog, okay? Itong gonorrhea infection na ito. Okay? And then we also have cervicitis. Cervicitis, very common among the females. Okay? The primary infection in the endocervix. Okay? And then this can also extend to the urethra and vagina, giving rise to mucopurulent discharge. Now, this cervicitis, this may progress also to the uterine tubes, causing salpingitis. Okay? Salpingitis or the inflammation of the fallopian tube. Okay? Salpingitis. Aside from salpingitis, pwede rin mag-complicate yan into fibrosis. Okay? Obliterating now the tubes, the uterine tubes of the female, causing also infertility among the females. Okay, and then we also have gonococcal bacteremia. Again, we mentioned a while ago that these bacteria, they are also capable of tissue invasion. Kaya nagkukos ng gonococcal bacteremia yung bacteria na yan. Okay, especially yung mga patient, ang very susceptible sa ganitong klaseng infection is yung mga patient with complement deficiency. Especially yung may mga complement deficiency. Okay. Now, these patients, okay, with gonococcal bacteremia, Okay? Dalawa lang yung pwedeng maging complication yan. It can lead to skin lesions, especially hemorrhagic papules and pustules, and gonococcal arthritis. Yung tinatawag nating suppurative type of arthritis, your gonococcal bacteremia. Aside from gonococcal bacteremia, very common also is your ophthalmia neonatorum. Ophthalmia neonatorum among the newborns, okay, this is a type of infection of the eye among the newborns which can be acquired during passage through an infected birth canal of the mother. Okay? Now, the initial conjunctivitis can rapidly progress. Okay? And then, if left untreated na naman, it can actually lead to blindness. It can cause blindness sa newborn. Okay? Now, to prevent this gonococcal ophthalmia neonatorum, instillation, okay, pwede tayong mag-administer ng erythromycin, or pwede rin tetracycline, or one of the oldest prophylaxis that we use is your 1% silver nitrate, also known as your Creed's prophylaxis. Okay, so these three, antibiotic, your erythromycin, tetracycline, and even your silver nitrate will do to prevent your ophthalmia neonatorum. However, this one, your silver nitrate, hindi na siya masyadong ginagamit considering that this is a heavy metal reagent. Okay? Okay, and then we also have pharyngitis. Pharyngitis caused by your Neisseria gonorrheae also. Okay? Infection of the throat area. Okay, we also have anorectal infections and gonococcal endocarditis. Remember, si Neisseria gonorrheae, di ba? Capable din siya of infecting the throat area. Siguro kung napabayaan yan, dahil capable siya of invasion, pwede yan mapunta din sa heart, di ba? So that is why they are able to cause gonococcal endocarditis. However, it is not very common naman. Now, the specimen selection, collection, and handling of specimen for Neisseria gonorrheae isolation, this one's of the most important element in the laboratory diagnosis of your Neisseria gonorrheae infection. Okay, so these three, specimen collection, and handling. Okay, now for the specimen of choice, okay, usually mga pus and secretion coming from urethral area. Okay, pwede din yung specimen na nagaling sa cervix, prostate, even the rectal area, mucosa, okay, mga mucosal area, and even the throat. Pwede yan mga specimen na yan. Okay, so accepted specimen yan for isolating your Neisseria gonorrheae. Okay, now as for the collection, again, ano yung sinabi natin dun sa previous discussions natin? Pag mga Neisseria yung mga yan, dahil fastidious sila, bedside collection is preferred, di ba? Bedside collection is most likely preferred. Okay? However, if bedside collection is not possible, pwede naman tayong gumamit ng mga transport media. Okay? But before we go to that, again, let us recall ano yung mga accepted swab na gamitin lang for isolating your Neisseria gonorrheae. Diba? We can make use of Dacron or rayon swab. Okay. Now, again, what is the reason? What is the reason why hindi tayo pwedeng gumamit ng cotton swab? Again, bakit hindi tayo pwedeng gumamit ng cotton? Kasi this cotton swab, they have this fatty acid that is highly toxic for your Neisseria gonorrheae, inhibiting their optimal growth. Okay, so the use of cotton swab is not appropriate for collection due to the presence of fatty acids. However, considering class that yung ibang laboratory, wala namang ganitong available na swab. Wala namang ganitong available na swab like your Dacron and rayon, kaya hindi may iwasan na gumamit ng cotton swab. Okay? Now, if cotton swabs are used, okay, at least yung transport medium natin, they should at least contain charcoal. Okay? Ito, yung charcoal, dapat yung transport medium natin, it should at least contain charcoal kung gagamit man tayo ng cotton swab to inhibit now to inhibit the toxicity of the fatty acid. Ito yung charcoal na ito. Ito yung mag-inhibit dun sa toxicity ng fatty acids ng cotton swab. Okay? Now for collection of specimen coming from the joint fluid or CSF man yan, diba? Remember, your gonococci, they can also cause arthritis, kaya possible din na makatanggap tayo ng mga joint fluid as specimen or even CSF. Okay, now if that is the case, it must be kept at room temperature. It must be kept at room temperature or at 37 degrees Celsius before culturing. Bago mo siya i-streak sa culture media mo. Why? Because this bacteria class, always remember that they are cold-sensitive organism. That is the reason why they must be kept at room temperature or at least sa 37 degree Celsius. Okay? Now, important note to remember, if swabs are used for collection, the specimen must be plated within 6 hours. Do not forget that one. Okay? If swabs are used for collection, the specimen must be plated at least within 6 hours. Okay? So, it must be plated within 6 hours. Okay. Now, as for the handling, for handling of specimen, okay, if collecting blood, for example lang class, if you are going to collect blood for blood specimen for culture, okay, let's say for example, if it is collected in a vacutainer tube, the blood must be transferred to the broth culture system within 1 hour of collection. Okay, so do not forget this one. Okay, for example, magko-collect ka ng blood sample for culturing your Neisseria, okay, you must transfer it immediately sa broth or hindi man possible immediately, at least within 1 hour nalipat mo na. Okay? And then also important note to remember, your Neisseria gonorrheae is very sensitive. They are very sensitive to what? To SPS additive. Okay? I'm very sure you know what is this one, your SPS. Okay? Dahil sensitive yung mga yan, the content in blood culture bottle should not exceed, they should not exceed 0.025% of SPS. Now, let us continue with the laboratory diagnosis of your Neisseria gonorrheae. Okay, now as for the gram stain, for the gram staining characteristic of your Neisseria gonorrheae, okay, gram stain smears of urethral or cervical exudates may reveal gram-negative diplococci. Okay? So, kung imagine ninyo class, this diplococci, for example, this is your polymorphonuclear cells. Okay? Your diplococci must exist inside your polymorphonuclear cell. Okay? So, ganyan. So, kung mga naging medtech na kayo, dapat, okay, ganito yung makikita nyo if a suspected case of Neisseria gonorrheae. Okay? So, ganyan ang itsura niya. Diplococci. Coffee bean shape. Dapat yung pagiging cocci niya parang mas busog yung itsura niya, mas matataba, mas larger compared to your typical cocci. Okay? Now, this diplococci, okay, inside your polymorphonuclear cells is said to be diagnostic of gonorrhea. However, dapat once na makakita ka ng ganito sa smear mo, you should not assume it already as gonorrhea. Diba? You should always perform muna biochemical test. Okay, we have your superoxide test, your oxidase test. Okay, pwede mo rin siyang i-base sa may mga immunological test na din tayo, and even the the appearance of your culture. Okay, so it is very important to do correlations. Okay, now however, if your gram stain, your gram stain smear with more than 5, sabihin natin nakakita ka ng more than 5 polymorphonuclear cells per field, pero wala ka namang nakitang bacteria. Okay, sabihin natin wala kang nakitang bacteria, pero marami kang nakitang white blood cells, pero wala yung mga diplococci na sinasabi natin. Okay, possible yan class, or it is highly suggestive. It is highly suggestive of what? Of non-gonococcal urethritis. We call it non-gonococcal urethritis. Okay, and then this non-gonococcal urethritis, it is usually very common, a common finding of what bacteria? Your chlamydia. Okay, so pwede. Pinagkaiba lang, your Neisseria gonorrheae, merong mga diplococci sa loob mismo ng polymorphonuclear cells natin. Okay, now as for the culture of your Neisseria gonorrheae, immediately after collection, okay, again, paulit-ulit tayo, the specimen must be plated immediately on enriched selective media, okay, and it must be incubated in an atmosphere with an increased carbon dioxide. Okay, at least yung environment class ng bacteria mo while incubating it, it should have at least an increased carbon dioxide. Usually, pwede na yung 3 to 5% carbon dioxide. Remember, they are said to be capnophilic also. Okay? So, they must be incubated and plated immediately, at least for 72 hours. Okay? 72 hours. Sa ibang libro, 48 hours. But maximum na yung 72 hours at 35 to 37 degree Celsius. Okay? Again, we should always immediately incubate it, okay, or plate it immediately kasi nga mga fastidious organisms yung mga yan. Okay? However na naman, if immediate incubation is not possible, the specimen should be placed in a carbon dioxide containing transport media. May mga transport media naman tayo na equipped with a high carbon dioxide atmosphere such as your candle jar. Ito, mga transport media, itong mga ito. We have your candle jar. Okay? Kung walang candle jar, we can make use of Gembec. Okay? What is the meaning of Gembec? Your Gembec stands for James, or sa iba class, they call it John. Pero sa libro, it is James E. Martin. James E. Martin, Biological, Environmental Chamber. Okay? So your Gembec and your candle jar, these are the primary transport media for your Neisseria gonorrheae kasi they are carbon dioxide containing transport culture system. Now, humidity can be maintained by placing a sterile gauze pad soaked with distilled water dun sa bottom of candle jar natin if you're going to incubate your specimen suspected with Neisseria gonorrheae. Now, as for the culture media of your Neisseria gonorrheae, okay, primary culture na ginagamit nating class for isolating or cultivating your Neisseria gonorrheae is your chocolate agar plate. Especially for sterile specimen. Yan ang ginagamit natin, your chocolate agar plate. Now, we have this different selective agar for your Neisseria gonorrheae. We have your Thayer-Martin agar, modified Thayer-Martin, Martin-Lewis, New York City agar, your G-Select, and your different transport media. Okay? Now, this agar, what makes it selective is because of the presence of different antibiotics. Okay? So, number one, we have your Thayer-Martin agar. Your Thayer-Martin agar, primarily chocolate agar lang din yan. Okay? So, this is a chocolate agar which is enriched enriched with isobitalex. We call it isobitalex. Okay, actually your isobitalex is a supplement which is used as an additive to culture media for cultivating your, especially your fastidious organism. Okay, so ginagamit yung isobitalex as an additive to cultivate your fastidious organism. Okay, such as your Neisseria gonorrheae. Now, as for aside from your isobitalex, your Thayer-Martin agar is also infused with antibiotics such as your vancomycin. It is also infused with colistin. Okay, colistin and nystatin. Okay, each of which this antibiotic, they have their own specific uses. Okay, for example, your vancomycin, para saan yan? Okay, they are gram-positive inhibitor. Okay, gram-positive inhibitor. We also have colistin. They are gram-negative inhibitor. And then your nystatin naman, they inhibit the growth of your fungal elements or your yeast. Okay? And then we also have your modified Thayer-Martin agar. Your modified Thayer-Martin agar, okay, it is composed of all of this antibiotic, the components of your Thayer-Martin agar, lahat yan kasali dun sa modified Thayer-Martin agar natin, your vancomycin, your colistin, your nystatin, including it is added with trimethoprim lactate. Okay? So, para saan yan trimethoprim na yan, class? This antibiotic, it inhibits the swarming phenomenon of your, specifically your proteus organism. Okay? So, inhibits the swarming phenomenon of your proteus organism. Okay? And then next, we have your Martin-Lewis. Your Martin-Lewis agar, it composed of all the components of your modified Thayer-Martin agar. So, it includes your, sulat natin, your vancomycin, your colistin, your nystatin, and your trimethoprim lactate, except that your nystatin, it is substituted with anisomycin. Okay? So, instead of nystatin, okay, ginamitan ng anisomycin to inhibit the growth of yeast also. Okay? For your Martin-Lewis agar. Okay? And then next, we have your New York City agar. Your New York City agar is a transparent medium infused with lysed horse blood. Okay? It is composed of lysed horse blood, okay, horse plasma, yeast dialysate, and antibiotics, which includes your vancomycin, your colistin, okay, your trimethoprim, and your amphotericin B. Okay? So, your New York City agar, it is composed of vancomycin, colistin, okay, your trimethoprim lactate, and your amphotericin B. Okay? So, lahat itong tatlong to, pareho lang din ang uses yung mga yan. Okay? And then, for your amphotericin B, it inhibits naman the growth of fungal elements also. Okay? And then, we also have your G-Select medium. Your G-Select medium, pareho lang siya ng components with your New York City agar. Okay? So, it is composed of vancomycin, ganun ulit, vancomycin, colistin, trimethoprim lactate. Okay, isin natin, vancomycin, trimethoprim, colistin, amphotericin B, plus it is added with lincomycin. Okay, it is added with lincomycin. Okay, para sa si lincomycin class, it is used to inhibitor of gram-positive also, your lincomycin. Okay? And then, for transport medium of your Neisseria, we can make use of yung mga minention natin kanina, such as your Gembec, your Cariblair, your Amis, and even your transgrow. Okay, so all of this media is used to transport specimens for Neisseria gonorrheae. Okay, your Gembeck, Cariblair, and Amis. Now, as for the biochemical test of your Neisseria gonorrheae, okay, number one, we have your carbohydrate utilization test, which is the standard method of identifying your Neisseria species. Okay, so wag kakalimutan, class, your carbohydrate utilization test is said to be the standard method of identifying your Neisseria species. Okay, now with the use of cysteine trypticase agar, which contains 1% carbohydrate, and a phenol red, okay, which serve as your indicator, we can now detect acid production from either glucose, maltose, okay, lactose also, fructose, and even sucrose. Paano yung procedure ng test, class? If you want to identify your, for example, your Neisseria gonorrheae, okay, gagamit ka lang ng cysteine trypticase agar, okay, and then you're going to infuse it with 1% glucose, ganyan, okay, and then kapag after incubating your sample at 35 to 37 degrees Celsius, after 24 hours up to 72 hours, kapag merong acid production yan, it should result to yellow color. Okay? So, kung iniisip nyo, class, itong carbohydrate utilization test na yan, it is actually a series of tube which contains your different sugars. For example, your glucose, your lactose, maltose, and etc. Okay, so at the end of this topic, your Neisseria, pag natapos na natin yung meningitis and the like, I will also explain the principle of this carbohydrate utilization test. Okay, now aside from this test, we can also perform oxidase test. Okay, considering that your Neisseria gonorrheae is oxidase positive, of course, they will yield into positive result, which is purple color. Okay, the positive result of your oxidase test with the use of this reagent, your tetramethyl paraphenylene diamine dihydrochloride, okay, we have your positive result of purple color. Okay, this one. Okay, aside from oxidase test, we can also perform superoxole test. Yung superoxole test, class, pareho sila ng principle ng test ng catalase test. If you remember in your staphylococci, however, ang pinagkaiba lang nila is the concentration of your reagent, which is usually 20 to 30% of hydrogen peroxide with a positive result of vigorous bubbling formation. Okay? And then next, we have your beta-lactamase, also known as your cephalosporinase test. Okay? Now, since your Neisseria gonorrheae is beta-lactamase producers, yung mga yan, we can utilize this test. Okay? Do not forget, your Neisseria gonorrheae is beta-lactamase producer. That is the reason why your Neisseria gonorrheae, they are highly resistant to what antibiotic? Your penicillin. Okay? So, hindi na tumatalab ang penicillin sa mga gonorrhea. Okay? So, until now, according to report of some reports of CDC. Okay? Now, your cephalosporinase test, we are going to make use of your cephalosporin disc, or pwede rin natin gamitin, also known as your cephinase nitrocephin disc. Okay, so we can make use of your cephalosporin disc or your cephinase nitrocephin disc. Okay, now the positive result of this test is deep pink color or pwede ring red color. Okay, so positive result, deep pink color or red color. Okay, now aside from your beta-lactamase, okay, we can also perform DNA test. Okay, however, this test, your DNA test, ginagamit lang siya to differentiate your Neisseria gonorrheae, which is DNA negative. Negative yung mga yan, yung gonorrhea natin. Okay, negative your gonococci. Okay, and then positive for your Moraxella cataralis. Okay, so actually differential test lang siya between your Neisseria gonorrheae and your Moraxella cataralis. Okay? And then aside from this, all of these tests, we also have available molecular assays and your immunological test, which is highly specific and sensitive tests, such as your fluorescent antibody testing, your coagglutination test, and your ELISA. Okay, so may mga available na tayong immunological assays. Okay, now we have this what we call your matrix assisted. Okay, sulat natin, matrix assisted matrix assisted laser desorption, ionization, time of flight mass spectrometry. Okay, so this test stands for matrix assisted laser desorption, ionization, time of flight mass spectrometry. Now, para saan itong test na ito? This test has the potential to provide rapid identification of your cultured isolate. Okay, so for example, may tumubo na dun sa culture media mo, you can make use of your colony. Pwede mo nang i-bypass itong mga biochemical test na ito kasi this test is very rapid. Okay? Now, as for the treatment of your gonorrhea infection, okay, now since the development and widespread use of penicillin, okay, gonococcal resistance to penicillin has gradually risen. Okay, so ibig sabihin, hindi na tumatalab yung penicillin kay gonorrhea. Okay, that is why many strains of gonococci requires a high concentration of penicillin G with a minimum inhibitory concentration of at least more than or equal to 2 microgram per ml. Okay? Now, resistance to resistance to tetracycline, okay? Resistance to tetracycline. Tetracycline. Ano pa? Spectinomycin. As well as your fluoroquinolones. Okay? These antibiotics, wala na siyang talab kay gonorrhea. Okay? So, itong mga antibiotic na ito is very resistant na for your Neisseria gonorrhoeae. Okay? This one plus your fluoroquinolones, isa siya sa pinaka unang ginagamit na gamot to treat your Neisseria gonorrhoeae. However, this one, hindi na siya masyadong effective against your Neisseria gonorrhoeae. Now, because of this problem with antibiotic resistance in your Neisseria gonorrhoeae, the CDC recommends that the patient must be treated with ceftriaxone. Okay, so ito na yung ginagamit. Ito na yung common antibiotic which is administered to the patient. And then this ceftriaxone is usually given intramuscularly. Okay? Or pwede naman, okay, alternative antibiotic, we have your cefixime. Your cefixime is orally administered as a single dose. Okay? Now, for pregnant females, if you're wondering, okay, just in case, di ba, may mga patient tayo na pregnant women, which is usually infected with gonorrhea, pwede naman silang mabigyan ng antibiotic. Okay? We have actually available antibiotic, which is proven safe and effective for pregnant female, and then that is your azithromycin. Okay? And then as for the prevention and control of Neisseria gonorrhoeae infection is, of course, sexual abstinence. Okay? Sexual abstinence and safe practices of sexual activities.